Very good morning to each and everyone, and special thanks to Dr. Subhash for including me in this instruction course. Well, a proper wound construction paves a way for a smooth and uneventful phacosurgery. A small incision, farthest possible from the center of the cornea with no gape and no suture, is closest to the ideal incision and will induce least postoperative astigmatism. Before we actually impinge upon the actual business, let's have some idea about the applied anatomy of the limbus. We divide limbus in two zones, anterior limbal zone and the posterior limbal zone, by three lines. The first line, which is very obvious, which can be seen, is an attachment of conjunctiva and tenons to the cornea that forms the anterior limbal line. And once we expose the area, we'll see a blue zone. The end of the blue zone is a middle limbal line, 1 millimeter posterior to it is a posterior limbal line. The area between the anterior and the middle limbal line is anterior limbus, and the areas just behind that is the posterior limbus. So with this anatomy in our mind, and another principle is a principle of astigmatic neutral funnel. Basically, this is based on the principle that the astigmatism is inversely directly proportional to the length of the incision and inversely proportional to the radius. By this, a 3 to 3.5 millimeter limbal incision produces a minimum astigmatism of say 0.25 to 0.5 diopter. So, limbal astigmatic neutral zone is nothing but a conceptual, virtual zone in the sclera. Any incision lying within the astigmatic neutral funnel will create the least astigmatism. So, I'll be discussing incision making in these four headings. One is the site, position, shape, and the length of the incision. We classify incision according to the site in following headings like temporal, superior, oblique, and on the axis of greater corneal curvature. The temporal is the most favored, while on the axis of greater corneal curvature is the most accepted site. But then each and every site has got its own merits and demerits. So, temporal incision is favored because it is ease of access, because the distance from the periphery to the visual axis is more. There is no role for the bridal suture, better red reflex, prevent pooling of the blood, better results in terms of the astigmatism, and minimizing the effect of the Bell's phenomena. But then again, there is a role for the superior incision also, especially for those who will progress from SICS to the phaco, because you are well conversant with the scleral incision and the SICS. So that can be a very good tool for beginners to have a superior incision, superior scleral incision, I mean. So in terms of position, we can divide the incision into a scleral, limbal, or a corneal incision. Again, a scleral incision would be a better option for a beginner, but then the favored incision nowadays is a clear corneal incision. The advantage of the scleral incision is, how to make a scleral incision is very easy for the people who are well conversant with the SICS. It is made at 1.5 to 2 millimeter posterior to the limbus. It has got 3 dimension. The depth, which is 300 to 500 micron, a width of 3 millimeter, and length will vary according to the lens you want to implant. The advantage is that it produces a minimum astigmatism and better sealing effect. So we have a different kind of corneal incision, uniplanar, that is called a stab incision, or a biplanar incision, a triplanar incision, or a hinge incision. As we go on increasing the plane, the valve action increases, but then again we do it at a cost of astigmatism. So the balanced approach would be to form at least a biplanar or triplanar incision, which will give you a good valve action as well as a minimal astigmatism. This is a video which will show you how to give a triplanar incision. You have to give a scratch incision first. You can use blades also for giving this scratch incision, or you can use the keratome also. And this is how you enter in the clear cornea. This is second plane you are entering. And when you go to the desired breadth, you have to depress it, forming a dimple, and this basically is showing you how a triplanar incision is made. And this is most commonly performed incision is just in the right side. It is called a stab incision or biplanar incision. So a true self-sealing incision is sutureless, A corneal valve creation needs at least 1.75 millimeter length of the incision, and the approximate geometry should be a square geometry. So, as how a self sealing is achieved, it is said that the triplanar incision gives the best self sealing because there is ample space for attachment of the inner lip to the outer lip. So, if we consider the shape, we can have different shapes. Ideally, these shapes are basically for SICS, because most of the time in phaco incision are all straight incision only. But then again, just to have a fair idea about the corner incision, I included this slide. About the length of the incision. The length of the incision, we have so many advancement in the cataract surgery nowadays. People are doing sub 1 millimeter incision, or 2 millimeter, 2.2, 2.8, 3.2, and of course you can go up to 6.5 millimeter if you are going to put a non-foldable lens. It says that insertion with the forceps or the injector widens the incision by next 10%. An astigmatic neutral incision would be a scleral incision of 4.5 millimeter and a corneal incision for 4 millimeter. Now, a word about the on-axis cataract incision and opposite CCI. A 3.2 millimeter incision induces a 0.25 to 0.5 diopter of astigmatism. Incision on the steep axis will lower the pre-existing astigmatism of this amount. By adding an identical penetrating clear corneal incision opposite to it, it is possible to correct another 1 diopter of the astigmatism, and this needs no extra instrumentation. So, having done with the do's of incision, let's have some don'ts, because don'ts are very important. This incision basically was meant with a blunt instrument, and you can see that it hit the anterior capsule. The another incision which is made little posterior will create a conjunctival ballooning here, and your surgery becomes messy. Thank you very much.